Good morning. Okay, good morning. Distinguished guests, colleague, fellow health advocates, and this is the great honor for me to stand here to share insight on the topic that sits at the very intersection between technology and health. So the topic is not only timely but urgently needed to our collective pursuit of better health outcome. We call it as the artificial intelligence driven prognostic scoring for non-communicable disease, a pathway to achieving global health goals. So let's say I start with the simple question. What if we could predict disease before symptoms appear and intervene just in time to save a life? So this is not a science fiction anymore. So thanks to the convergence of AI and healthcare, and this vision is rapidly becoming our reality. So today I will sharing insight in how AI-driven prognostic scoring tool for non-communicable diseases, which help us to accelerate process toward global health goal, particularly in low and middle income countries. So we are living in the era where NCDs such as diabetes, chronic kidney disease, cardiovascular diseases have quietly become a leading causes of mortality and morbidity worldwide. Unlike infectious disease, NCD won't arrive with a bang, but rather they accumulate silently and often go unnoticed until it is too late. So at the same time, we are witnessing rapid advancement in digital technology, particularly AI and machine learning, which are transforming every sector, including healthcare. The question is no longer, at the same time, the question is no longer can AI help us, but rather how do we best use AI to make a meaningful impact, especially in preventing and managing NCD. Okay, today I invite you to explore how AI, when harnessed thoughtfully and ethically, can revolutionize our approach to risk prediction, early diagnosis, and personalized intervention for NCD through prognostic scoring system. And more importantly, how such innovation can accelerate our journey toward achieving the United Nations SDG, mostly SDG number 3, ensuring healthy life and promote well-being for all at all ages. So let us begin this conversation with a simple yet powerful idea. What if we could predict disease before it begins? And what if it could intervene early, not just to treat, but to prevent? Okay, ladies and gentlemen, to understand the urgency of embracing AI in healthcare, we must first confront the gravity of the challenges we are facing, the rising tide of NCD. NCD is no longer just medical concern. This is an economic burden, development obstacle, and most critically, a global health crisis. According to the WHO, NCD are responsible for the approximately 74% of the global health deaths, then around 41 million lives lost every year. And what more concerning is that 17 million of these deaths occur prematurely and affecting people under the age of 70. Most of these premature deaths are preventable. To address this, the international community comes together under the United Nations SDG, particularly SDG number 3.4, which call for a one-third reduction of the premature mortality from the NCD by the year 2030 through prevention, treatment, and promotion of mental health and well-being. But how are we doing? At our current pace, we are not on track. Okay? Many low and middle income countries face challenges in the early diagnosis, timely intervention, and sustained healthcare access. Despite national strategy and public health initiative, the burden of NCD is still climbing, silently affecting household, workforce productivity, and national development. One of the biggest obstacles is the early detection. While critical, it often insufficient and delayed. Our healthcare system are largely built on reactive model. So we may reactive model awaiting symptom to appear before intervening. By the time the patient come into clinics with the sign and symptom, we may already too late. So we must ask ourselves, why are we still waiting for disease to progress before acting? So traditional risk assessment like checklists, scoring chart and manual algorithm have in that help us to move from guesswork to some degree of structure. But these tools come with their own set of limitations, such as they are often static, they are lack of personalization, and perhaps more significantly, they are not easily scalable or integrated. What we need is actually a transformational shift from reactive to predictive care, from generic to personalized strategy, and from fragmented health record to integrated intelligence. This is where AI-driven prognostic scoring system can make a meaningful and measurable impact. Okay, ladies and gentlemen, now that we have acknowledged the scale and urgency of non-communicable crisis, and let us turn to what gives us hope: the power of AI. AI is not just a buzzword. This is a realm in healthcare and offer a new lens through which can understand risk, anticipate disease, and intervene early, far before symptoms arise. It allows us to ask new questions, find hidden patterns, and make prediction with a level of accuracy and speed over before possible. But how exactly does AI do this? At the heart of AI promise lies its ability to process vast and complex data. Unlike traditional models, they are often limited to a few variables. AI algorithms can learn from the synthesized thousands or even millions of data points from diverse sources, including electronic health record, laboratory results, socio-demographic variable, and behavioral pattern. So AI does not look at this variable in isolation. It identifies non-linear relationship, interaction, and subtle trends that might elude human clinicians and traditional statistical model. To achieve this, AI applies machine learning, a subset of AI that allows systems to learn from data and improve over time. In healthcare, several machine learning models have already shown promise in disease prediction, such as logistic regression, decision tree, random forest, neural network, deep learning, and so on. Okay, ladies and gentlemen, let me now talk you through the examples of how AI-based prognostic scoring can be applied in clinical practice. So let's say we conduct a retrospective study, retrospective cohort study using data from thousands of patients with type 2 diabetes in a tertiary setting, with the aim of develop a prognostic scoring tool powered by machine learning to predict a 5-year risk of developing chronic kidney disease, and which is one of the most common and costly complications of diabetes. We began with the data extraction for the electronic health record, spanning a 5-year period. We select variables based on the clinical relevance and data availability, which include demographic variable, clinical comorbidity, laboratory marker, and so on. So the data set will be divided into two, which is the training set and validation set. So several machine learning algorithms will be tested, including logistic regression, decision trees, random forest, gradient boost model, and many more. Let's say after model comparison, XGBoost emerged as the most accurate and interpretable algorithm for our data. So we evaluate the model performance by using key metrics such as the area under the curve, sensitivity, specificity, and so on. And the most importantly is we also assess calibration to ensure that predicted risk match with actual observed outcome, which is the crucial for clinical trust. The model transformation is not only its accuracy, but its ability to stratify patients into low, moderate, and high-risk group. The risk stratification had immediate clinical implication. Let's say the high-risk group, we can refer straight away to the nephrologist. Moderate risk, they could receive the intensified monitoring and lifestyle counseling. For the low-risk patient, could be managed in primary care, reducing unnecessary referral and costs. So, additionally, the model generated personalized risk report for each patient, and this enhanced both shared decision-making and self-management. So what does this mean for health system? This approach aligns closely with the principle of universal health coverage, and it supports cost effectiveness, scalable, equitable care delivery. By focusing resources for the most at risk, we can reduce the burden on tertiary services while ensuring no one is left behind. AI in this case become a bridge connecting big data with frontline care and policy emission with clinical action. So most importantly, this model is not scientific action. This is real, this is deployable, and it has the potential to be adapted to other non-communicable diseases. Okay, ladies and gentlemen, while the promise of AI in healthcare is enormous, it would be irresponsible to speak of innovation without acknowledging the real-world challenge that stand in the way of its safe, fair, and effective implementation, particularly in the low and middle-income country. So let's begin with the most pressing issue, which is data privacy. AI model require large volume of sensitive health information, from the laboratory result to diagnosis, from treatment history to behavioral pattern. If not protected with the high ethical standard, this data could be misused, leaked, and exploited. Therefore, we must develop systems that prioritize patient consent, secure encryption, and data anonymization. Secondly, we must confront with the issue of bias. AI is not inherently objective. This is only as far as the data is trained on. If the data is skewed, then the AI will reflect and even amplify those disparities. And this brings us to the next challenges, which is the explainability. Many advanced AI models, particularly deep learning systems, are often referred to as black boxes because their decision-making process is not transparent. Therefore, clinicians, patients, and policymakers must be able to understand how and why a risk score is generated. Without this, we risk eroding confidence, and more critically, we risk making decisions without accountability. Moreover, for all AI models to be effective in diverse populations, they must undergo rigorous clinical validation and local calibration. So, AI tool must integrate seamlessly with existing health information system, whether there is a national electronic medical record platform, district-level disease registry, or mobile apps. Therefore, we must prioritize ethical design, inclusive data practices, and strong governance framework, which include enforcing regulation, ensuring algorithm transparency and auditing mechanism, promoting capacity building among healthcare workers and data scientists, and fostering public-private partnership to support infrastructure training and local research. Ladies and gentlemen, as we have explored the promise, the application, and ethical challenges in AI in managing NCD, a fundamental question remains. What does all of this connect to the broader picture of global health? The answer lies in our shared global commitment, particularly in the United Nations SDG. More specifically, Target 3.4 aims to reduce premature mortality of NCD by 1/3 at the years of 2030 through prevention, treatment, and health promotion. And this is not just a policy ambitious, this is a moral imperative. When deployed responsibly, AI can support early detection, empower primary care provider, improve efficacy, inform policy that are data-driven, equitable, and sustainable. So AI is not here to replace the human touch of healthcare. It is here to enhance it. It is enabler, a partner, a powerful ally in transforming care from reactive to proactive, from hospital center to the community base, and from generic to personalized. With AI-driven prognostic tool, we can optimize limited resources, reduce premature mortality, and ensure that no one is left behind. Okay, in conclusion, the AI-driven prognostic tool is not just a tool, this is a pathway from fragmented data to integrated action, from the late stage treatment to the early stage prevention. But innovation alone is not enough. We need leadership, policy reform, capacity building, and most at all, collaboration. Let's not wait until the next health crisis to act. Let's leverage AI responsibly, not to replace human touch, but to amplify it. So the future of the NCD prevention is not only in the laboratory, it is in the algorithm we train, the system we build, and the story we tell with our data.